it's Matthew Holt here with a quick THCB spotlight. It's the 8th of December, and there's some interesting news this morning for a couple of companies I've been watching, but have been in the background for a while now. And here we have Dave Wessinger, who is the president of PointClickCare, and Chris Klomp, who's the CEO of Collective Medical. I want to stress Collective Medical, not Collective Health. So and the last one, but. And they're announcing this morning that Dave's company is going to acquire Chris's. PointClickCare is going to acquire Collective Medical. So before we dive into this, Dave, I haven't had PointClickCare on here before, but you guys are in the business of EMRs, but not kind of those EMRs that people know about for acute care hospitals, but mostly in the post-acute and long-term care setting. You're based in Canada. So say a word about what your business is and the sort of scale you're at now before we discuss Collective.
All right. Yeah, very quickly, we're a cloud-based healthcare company largely focused on post-acute care and senior living, and delivered over the internet, as you would imagine. We started the business back, 20 years ago, and have been on a drive to really provide technology and solutions to those that need it the most, that care for the most fragile in our population, and really excited to enable them with tools and technology and capability to help them on their path to care for those folks. And that's
I was actually reading a tad about you before I heard this announcement in a report recently, and you're probably one of the biggest, if not the biggest, sort of EMR in that sector. But it's not a sector, it's a sector which didn't get the money from the government 10 years ago, from the US government 10 years ago to expand literally. So give me a sense of the scale that you're at and the scale of opportunity for the growing electronic records in that post-acute long-term care sector.
Sure. Yeah, I think, there's a lack of awareness in terms of what's going on in that space. And I guess secondly, we didn't have the benefit of the meaningful use dollars. And so it's largely been driving forward on ROI. So you can't really adopt technology if we don't deliver immense value behind it. And so our focus with our customers was to enable them with technology, but then continue to grow that capability so they can perform better and create the transparency that we so need in that space across that sector, which generally has a bit of a black cloud over it, as you can imagine. So we fight the PR side often, but largely they're a great group of folks that are really committed to the mission of serving these folks. So we see a ton of opportunity and growth. We're approaching 70% market share in the skilled nursing space. We serve about 24,000 facilities, and that's not just lightly touch them, but we are a core system of record for them, and they have a ton of opportunity to grow their footprint wider with us and take on new solutions that empower them in a different way.
Give me a sense of how many facilities you're in, and then what's the open field left?
Yeah, so there's when you think about, there's really three pillars, and that's the skilled nursing, home health, and senior living space. We're largely dominant in the skilled nursing area, and really 8 of 10 in the senior living, 8 of 10 in the skilled, and really just kind of growing into where our customers are going, which is in the home health side. So very, very small penetration there today, but it equates up to, and I say facilities, but we would include in that facilities, communities, life plan communities, and home health agencies in the facility. So it's about 24,000, give or take.
Right. And you guys raised a decent amount of money, I think the $250 million or so over the last few years, but you're also, as you said, you've been around a while. And give me a sense of how many employees you have.
We have about 1,600 employees currently.
Right. So you're a I would call you established, right? But going forward.
Yeah, we have about 1,600 employees. Our active cloud-based solution serves over 1.1 million active patient records, and we have about 10 million available in kind of that broader kind of aggregated data platform.
That's fascinating. All right, Chris, switching to you quickly. Collective Medical is one of those interesting companies that you've been growing fast. You guys raised around 50 million, I want to say last year. Am I getting that right?
3 years ago, that's right.
3 years ago. So I heard that in my brain somewhere, right? In the relatively recent past, but you're in a different, what appears to be a different business, right? Which is accessing data between electronic medical records. So you started out, and I'll say when we spoke a bit about when you started out in the business of helping people in emergency rooms identify, opioid shoppers and trying to connect records in that area. But you obviously expanded on from them. But give me a sense about what the business has been to this point.
Yeah, that's right. It was one of my partner's moms who came up with the whole idea in the first place, and it was to solve one of her problems, which is as a social worker in the emergency department, she had patients whom she suspected were struggling with substance use disorder, and they would hop around to different emergency departments trying to deal with this, kind of tyrannical addiction that they face. And so we started really basic, just how do you take some encounter data and share that across hospitals so that care teams could operate more like a single team, frankly, and deliver a good care experience to the patient. That was, 10 plus years ago. Fast forward, as we've grown, we're the leading provider activation and care collaboration platform in the country now. And so we serve over a quarter of the hospitals, nearly every national health plan, and loads of other plans and accountable care organizations, some 80 plus million patients and 400 million plus visits. And what we do is we use real-time data to understand how patients move across the care continuum, but in real time. And then we look for those who might have something bad about to happen to them. It could be because they're about to have an overdose, or maybe they're about to readmit to a hospital and somebody like their primary care provider doesn't realize it. And if they knew, then they could intervene and maybe prevent that readmission from happening. And then we activate those providers and we give them the information that they need to intervene and mitigate the risk that we've found. And in the process of that, we are able to help patients lead healthier lives and do it at a lower cost to the whole system. So, it sounds at first blush pretty different than what Dave just described with PointClickCare. And yet, when you start to think about two major populations in the United States, vulnerable, or safety net populations where we've disproportionately focused, and the senior population where you've got some, I don't know, what is it, Dave, like 15,000 Americans turning 65 every day. Like all of a sudden you start to realize, hey, patients aren't making the distinction between if they're getting care at the hospital or a skilled nursing facility or at home. They just want to lead a healthy life. They're sick of fragmented care and disparate providers. And so, we should probably not contribute to that problem, but align and lead to a more seamless path for them. So then it starts to make a lot more sense.
Yes, that's very interesting, right? You get to the point where you guys obviously been noodling around. What do you do when you grow up, as most hopefully most companies are doing, rather than stuff.
I think my parents are still asking that, Matthew.
That's not about your personal life, but we see by the kids' bookcase behind you, Chris, what you're mostly up to.
I'm practicing. I'm going to grow up.
But in that case, right? So you come together. Obviously, the interoperability play could go in numerous places. There are a number of people coming into that, and some people, see people going to consumers, some people going to pharma companies. There's a bunch of people serving lawyers in that area, right? Workers' comp. But we've had at the same time, and Dave, you've been right at the forefront of this, over the last 9 months, particularly, so a crisis of disease and COVID now, so happening, and a lot of it happening in that SNF and senior living and long-term care space. And the same thing has been going on with trying to figure out who's got COVID and reporting data around and all that kind of stuff in your world, Chris. So was that the genesis? I know you guys have had a partnership for a while, but what was the genesis of coming together and saying, okay, we're actually going to make this as a partnership? I know, Dave, you guys have made a couple of acquisitions in recent years, but they've been people already in that kind of senior living space in pharmacy.
Yeah, no, this is definitely different. I mean, Chris and team aren't new to us. We've been working together for, I guess, officially since August last year, Chris, but have really started to understand each other's capabilities, where we sit, what our values are. And I think there's a variety of things that came together. I think timing is coincidental, I would say, but recognizing that had we come together 8 months ago, I think the visibility and the blindness around COVID would have been dramatically different. So I wish we had a thought of this a year ago and be able to execute, because we would have put the entire arena in a different place of awareness. Most providers, most folks involved were running blind, and that caused, serious issues. And so we know we can change that. We can't turn the clocks back, but we can certainly help on a go forward basis. But I think the genesis for us was we're both mission-driven organizations that are interested in transforming healthcare. This is not just about, let's figure out what to do and what's the next acquisition, or, how does Chris want to grow. We really firmly believe that we can change the direction, truly transform healthcare and achieve not just triple aim, but quadruple. So I think the ability for us to affect populations to improve care at a lower cost is right there. And we can't do it independent of each other. What we quickly realized was they have a footprint and they've been doing a lot of work around kind of creating real-time data intelligence. We have depth that we can add to that, so we can go wide and deep and enable a whole audience that will help improve the quality of care for a population beyond what we had ever envisioned before. So that's what's got me excited, Chris.
I agree with that. The one thing I will say, Matthew, is that COVID has, I think it's laid bare for a lot of us gaps in healthcare across the continuum. And you mentioned them, right? Not just care gaps, basic questions like what you posed of, well, I'm a discharging hospital, and which sniffs will take my patients right now, which have recorded cases of COVID, which don't, where is it safe? Basic questions, but not so basic to me when I'm trying to figure out where to send a patient and my beds are filling up and I'm out of capacity. Or other questions like, well, what the heck's going on? We don't have enough testing right now, and how are these patients tracking? And I think for me, the big blinding insight of all of this was, it kind of felt like digital health, the verdict on digital health wasn't quite rendered coming into this. It's like, well, a lot of money's pouring into this, and you cover it. Like, lots of money's pouring into this space. We're not so sure if it's actually a thing. Is it actually going to disrupt, or is that just like a capital D word that Silicon Valley is using? And I feel like that question's been firmly and completely put to bed now. Like, it's here. There are patients all over the continuum. The traditional healthcare system is not and cannot reach them. And you have to have more digital health infrastructure, and it has to be better. It has to be more seamless. It has to talk. People are sick of silos. They're sick of competitive dynamics that lead to fragmented care teams. They're just over it. And I'm over it. And so, this feels like a perfect furtherance of our missions. Yeah.
So I'd like to make a couple of things. One I think would be interesting is that if I get the integration right, because you're putting a lot more of the healthcare ecosystem on the map and enabling people to get visibility into it, which is very important. As you mentioned, under COVID, not only has been crisis in nursing homes, but also across the board, there's been. I'm literally giving a talk to a group in Japan about this tomorrow, about the lack of the fall off in visits, the fall off in emergency room admissions, the rise in things like hospital at home, et cetera, is going to happen. And obviously, you have infrastructure that plays. Both of you have infrastructure that plays across that. We've also seen a couple of way back, there was a well-funded failure in trying to do sort of telehealth in nursing homes about a couple of years ago, Call 9. They reconstituted themselves as, I forget their new name, but they reconstituted themselves again doing that same part of the outreach between acute and post-acute facilities. Let me ask you then, what do you have left that you need to bring on board in the new PointClickCare or the new combined company to sort of round out all those pieces that you're missing? It's not just about where do you send people, it's about how do you communicate with them. What else do you need that you don't yet have that we can expect to see you add, either organically or inorganically?
Yeah, I think, there's, it's interesting. Every provider is at a different stage of adoption. And so some are at the earliest phase and immature, and some are at I would say, farther down that path in digitizing. I mean, ultimately what we've recognized through COVID is you really can't share what you don't have electronically. And so you can't enable anyone, you can't provide transparency, you can't, as you've recognized through COVID, they couldn't even let families know, those that were in their building that had COVID. It was with all the things going on, but technology could have played a key role in that and really lifted the administration burden. And we've done that. So I think about, for us, really, it's about not getting too far ahead of the market and in providing solutions that help them provide better care ultimately and run a better business. And that continues to be our mission. And there's a variety of things around that. I could go on for hours about the additional components, but I would say the one area that I think is advancing that we've recognized, everybody back 10 years ago wanted unique care standards, right? Everyone had their own, they came up with their own care pathway. I don't think anyone's really fighting that anymore. So our ability with Collective and with our customers and our capabilities is to provide, if you're going to manage, somebody has sepsis, there's a way to manage through that. Everybody, roughly they're very similar. The ability for us to, through Chris's network, inform folks that this individual is moving through a pathway and they're following and adhering to this pathway as appropriate across care settings, not just in one setting, and then alert that individual that is in the care coordination side to really be able to intervene in care when it's necessary versus just do it from a monitoring perspective. And so we're really we talk about taking the value of a clinician to the highest level of their license. So they're not doing administration, but they're reacting to things they can react to and be preventative in care. And I think as we move and adopt to standardization, we understand this discrete data, and we enable and empower care providers to work across the spectrum, which is Chris's population and ours, to better provide the insights required to improve the patient care, is where this all lands ultimately. That's really the end goal, and the solutions that are required to do that are there. It's just really enabling them to be leveraged by the broader care team.
Excellent. All right. Well, that's great. Before I go, just a couple of mechanical questions on the acquisition. Number one, is there a price that you're announcing?
Billions.
Yeah. Okay. So they ramped up his credit card then.
Priceless.
Priceless.
No.
Invaluable. Right?
Invaluable. Yeah.
Invaluable. I assume this is a stock and not a cash acquisition, or am I is this completely under wraps? There is some incentive for Chris to continue to grow, I would hope, is one of the questions.
I'm sticking around. Really asking. We're not going anywhere. We're excited. I don't want to go anywhere.
And then how is the organization? What are you going to know about the branding and the names? Are you going to continue as two independent brands, and how? Obviously in somewhat different fields.
Yeah, I think as we recognize there's two powerful brands coming together, and I think being respectful of both, we're going to continue on a path to support them, and at some point that may change, but in the very near term, we're going to reflect both brands in the marketplace and leverage what Chris has built and we have built in that arena.
So there's not going to be a huge number of people from Utah moving to Canada anytime soon.
Gosh, I hope not.
Collective Medical, PointClear Technologies Incorporated.
Yeah. No, there won't be a mass exodus. No, I think we'll probably go the other way. So, no, really excited about having that home base in Utah. So this gives us a broader footprint to expand in the U.S. and access some really good talent that I know they have there.
Absolutely. Excellent. All right. Well, I've been speaking with Dave Wessinger, who's the president of PointClickCare, and Chris Klomp, who's the CEO of Collective Medical. And as of today, they are one company with two distinct identities, I think. But congrats on the merger, gents. Good luck in the future. It's Matthew Holt, the Healthcare Blog, signing off.
Thank you, Matthew. Thanks, Chris.
Thank you.